At the clinic here, we do holistic physical therapy, which encompasses integrative manual therapy and cranial therapy that Carol and Chris have been talking about. And the manual therapy we've been working with for so many years. But in addition to that, at our clinic, we do nutritional wellness. And the reason that we all feel that it's so important to really address the diet and sometimes even additionally supplement is because we can make all the changes in the world or support the person's body to create all the changes in the world that need to happen, regardless if it's concussion and head injury or something else. But if the person doesn't have inside them what they need to sustain those changes, just healthy nutrition, then it can be slow growth in making changes. So at the clinic here, what we typically do is, especially when someone is healing from a trauma, is we will make recommendations on how to create a less inflammatory environment in the body nutritionally. So that means eating foods that are not going to create more inflammation while you're already dealing with inflammation on, a cranial or neurologic level. And so that might mean recommending them to be gluten-free, for example. It doesn't necessarily have to be a lifetime choice, though it is for some of us, because we never know when we're going to have a trauma. But as an example, gluten is a very inflammatory grain. Gluten is found in wheat, in rye, in barley, things like that. And I'm sure many of you have heard that sort of buzzword, gluten-free. But that's an example. We might recommend eliminating refined sugars from the diet, because refined sugars like white sugar or high fructose corn syrup, things like that can be very toxic to the nervous system. And when you're trying to get your nervous system to regenerate, you don't want to put anything into your body that might inhibit that process. So we do a lot of dietary coaching, and what's wonderful about the way that we do it is because we have our hands on a person's body and we're doing regular body work sessions, we have the opportunity to support that person with regular coaching. But we can also give them a lot of education on the body and exactly why they would make those choices to eat in that way, how it would affect their body for the better. If you eat this particular type of food, this is how it would potentially affect this part of the body that we're working with, that we're trying to promote healing. So the diet is really helpful, and always to really support that particular clinical goal that we're trying to achieve with that person. But sometimes having nutritional supplementation can be helpful, and I'll give you an example of that. If you think about something like essential fatty acids or omega-3s or fish oils, and we've all heard of that terminology, and we see it sold at the stores and such. In the body, everything in our body is made up of cells. We learned that in biology class when we were very young. So if you think about our muscles and our bones, our dura mater, our brain tissue, our blood vessels, everything is made up of cells. And the wall of all of those cells have one thing in common. They are all created with what's called essential fatty acids, omega-3s. And what happens when we have any kind of trauma or infection, there ends up being a loosening of the junctions of those cell walls, a tearing, if you will. And the way that that's repaired in the body is with essential fatty acids, or omega-3 fatty acids. The reason why they're called essential is because our body doesn't make them. It just doesn't. So unless we're eating 3 tins of sardines a day, which Carol actually might eat, but I don't know anybody else that does, we don't actually ingest enough essential fatty acids for just day-to-day repair, let alone incurring a concussion. So if you even think about, people that are in their elder years, and just the amount of effort that their body's creating to just maintain themselves, let alone if someone falls and have a trauma or a sports-related injury. So one of the things that's very commonly recommended by us and by other nutritional practitioners is to supplement with essential fatty acids, or omega-3s. And we actually brought some samples. This is by a company called Metagenics, just as an example to show you what it is. And we have some brochures that have a lot of information about the physiology and metabolism of essential fats. You guys can pick some of those later. But just as a concept, having your daily dose of essential fatty acids is just as important as nutritional vitamins, except that the vitamins you might be able to get from food, green leafy vegetables, things like that. you really wouldn't be able to get enough essential fats, especially if you've had a trauma like a concussion, again, unless you're having 3 tins of sardines a day. So, a lot of times we'll be making suggestions like that are short-term suggestions to just support that optimal healing, and then things shift. The goal is, of course, to get someone to be able to just sustain themselves, maintain themselves, but oftentimes there's things like essential fats or probiotics, things like that help us to just live in this world that is constantly hitting us with whether it's toxins and pollutants or traumas that we might incur, and it just helps us to be really healthy.